Hi, this is Rick Tharp, RX Kinetics, with another Kinetics program demonstration. This time I'd like to show you how to access the program, set up, and make changes, and what those changes mean. Start by logging in, accept the disclaimer, click File, and then Setup, or use the keyboard shortcut Control S. The setup function is password protected. The Kinetics program ships without a password. The password is set whenever you access a password protected function for the first time. Please choose a password that you can remember. The function you change on the setup screen, the first one is the database folder. And this is a directory where the Kinetics database is accessed. This is important when you're using the program over a LAN and you're sharing a database. The next setting is the default dollar savings per consult. This is what shows up on the Pharmaceutical Care Plan tab. And this is, each time you perform a consult, this is saved to the data file, and you can perform reports, compile a report showing total dollar savings that you can show to your administration and show them how wonderful you are. The next parameter you can change is the login method, and we spoke about this earlier. The default login method is open, which means that new users can add themselves to the user list. You can close the login here, and that is only individuals with the administrative password can add new users. The next setting you can change is the age entry. You can choose either between the date of birth or age. I don't recommend you change this. Date of birth is a more specific parameter. The program will calculate the age. And since the intent is to keep a permanent record of patients, 2 years down the line that patient will be 82, not 80, and that might make a big difference in the calculation of creatinine clearance. So just for the sake of data integrity, it's best to use date of birth. The next parameter you can change is the default height and weight entry. Use metric system or the US system. Next parameter you can change is a creatinine entry, either using metric or international units or our US method of milligrams per deciliter. Next, you can change the default creatinine clearance method. You can choose among these methods here: Cockcroft and Gault adjusted body weight, Cockcroft and Gault total body weight, normalized, Jealous 73, or Jealous multi-step method, which is the one I recommend because it makes adjustments for changing renal function. The next set of parameters you can change are those that are used to calculate the adjusted body weight. And adjusted body weight is what percentage of weight above lean body weight do you add to lean body weight to make the adjusted body weight. And this weight's only used in those creatinine methods that are creatinine clearance methods that use an adjusted body weight. And this is an area that's open to interpretation. There are a lot of clinicians that have different opinions about whether to use strictly lean body weight, whether to use total body weight, whether to use an adjusted body weight. This has to do with the fact that creatinine is a byproduct of muscle metabolism, and patients do not necessarily have a larger lean body mass, and therefore not necessarily producing more creatinine. Therefore, if you use total weight, you'll tend to overestimate their creatinine clearance. Some clinicians prefer to use lean body weight no matter what. There is some data in the literature that suggests that you should add some of that excess weight and use an adjusted body weight. Nobody seems to recommend to use total body weight, but that method is available if that's what you prefer to use. And that's what this program, the philosophy of this program is not to force you into changing your tried and true methods, but to allow you to modify the program parameters to fit your practice. So you can change the amount of excess body weight that you want added. Some people use 20%, some people use 40%, some people 60%. When do you want that adjustment factor to kick in? If you want to start it in as soon as they get over lean body weight, then you would start it 1 times the body weight. If you don't want that to kick in until their weight is twice the lean body weight, you would put a 2 there. If you wanted to kick in when their actual weight is 50% over lean body weight, you could put 1.5. That's an explanation of what those adjusted body weight parameters mean. And those are, again, seem to be a matter of individual preference. The next parameters you can change are the body surface area method utilized. You can use the old Du Bois method, or you can use the newer, probably more accurate Musler equation. Next, you can change the report options. These are the consult form. You can have it either print a graph or not print a graph. You can have it not print an ideal dose or print an ideal dose, because apparently somebody might question the fact, why did you change the dose? It says, the computer says 89 milligrams every 11.5 hours. Why did you change it to 90 12 hours? Take it off of there and you won't have to explain what should be common sense to most people. But I digress. The next thing you can change is the consult report header. This is the title of the report. The drug name is automatically added to the front of this. So in this case, if you were dosing vancomycin, the report header would read vancomycin pharmacokinetic consult. You may want it to say dosing recommendation or some other conglomeration of terms that you think sounds great. That's where you change that. Or if you're using a form that already has that information on it, you can just select none and the header won't print. And finally, the next thing you can change is the font that's utilized on the report. These are whatever fonts you have installed on your computer. When you're done making the changes that you want to make, click Save, and that'll take you back to the main screen.